Good morning, everyone, and welcome. Elizabeth Koff, Secretary of Health, for those who don't know me. I'm a bit shy and reserving and don't like to have my picture plastered everywhere across the health system. I'd like to acknowledge the traditional owners of the land on which we meet, the Burra people of the Eora Nation, and pay my respects to elders past, present and future. To our board chairs, welcome. To our chief executives and executive staff, welcome. To all our clinical staff and researchers and support staff, welcome. This is a celebration of your achievement in New South Wales Health. I'm delighted to open the 2017 Symposium and love the title, Our Health Story, Our Health Future. That provides me with an opportunity to tell a little bit about our story, or the State of the Nation address about New South Wales health over the last 12 months, but also signal our future direction. It's hard to believe that it's 12 months ago we were gathered here for the Festival of Contagious Ideas. And it has been a 12-month period since then with some turbulence. We've had ministerial changes and events on the international stage have been quite significant. Some events took place that are very remote to us here in New South Wales Health, but still serve to reinforce to us something that we already knew. We all knew healthcare is really, really complicated. But most importantly, we know good healthcare is a really, really good thing. We have continued to deliver exceptional world-class care, and it may sound over-egged or overrated, but by most international comparators, the Australian health system performs very, very well. And here in New South Wales, in a yet-to-be-published document by the Australian Institute of Health and Welfare, New South Wales continues to be the best-performing state in the country. This doesn't mean we can come complacent or rest on our laurels. We are constantly confronted by financial pressures, the ageing population, and consumer expectation. But what I believe is important for us as a health system, clarity of purpose is critical. Measurement of performance is essential, and a culture of compassion and innovation is non-negotiable. All are critical elements for us to deliver the best of care. If we reflect on our story of the last 12 months, we have worked hard on the Premier's priorities. Once again, clarity of purpose in providing the direction on what the government's expectations are of the health system for the community of New South Wales. We have worked hard on delivering infrastructure across the state with some remarkable capital developments, both in the metropolitan regions and, most importantly, in rural and regional areas. And there are plenty more to come. Tackling childhood obesity, I think, is an absolutely critical initiative for us as a health system to address. It is hard, it is difficult, but we've set the target to reduce childhood obesity by 5 percentage points by 2025. The importance of that cannot be underestimated, as 80% of overweight children progress to being overweight adults, and the associated chronic diseases are there looming large. And who would not know about our Premier's priorities, improving service levels in hospitals, and a target of 81% of patients passing through our emergency departments within 4 hours by 2019. And those who experienced the recent winter months, where we had a phenomenal increase in attendances due to the influenza, I thank you for your commitment and contribution. It was a tough season, but I'm confident that all the initiatives we put in place to address the Premier's priorities made a big difference in our capacity to address those things. So, they were the Premier's priorities. What's the story for our health system? If we need clarity of purpose and direction, what are we looking at for the health system over the next 12 months and beyond? It was 12 months ago here that I outlined our approach in moving from volume to value. What we were signalling with better value healthcare was a recalibration of our system to ensure that we were doing the right thing for the right patients at the right time. The principle behind volume to value or better value healthcare is about shifting from measuring the outputs of systems. We're not interested in the numbers of patients we treat, though it's equally important, but we're interested in measuring the value in terms of the outcomes, the efficiency, and the effectiveness of the care we provide. The Leading Better Value Care set us on a journey, and we've consulted extensively across the state, received clinical input, and now we commence on our implementation phase of better value healthcare across the state with the Tranche 1 initiatives. I encourage you all to look at the ACI website and visit the ACI stand to have a look what's available on our better value care initiatives. But the better value care concept highlighted a number of other issues that we need to have clarity of purpose around. Patient safety first is something that I'm keen we make an explicit statement on our desire to be a health system that has the aspiration of providing harm-free care. It's so important that we do no harm to patients that we treat. And we've got well-developed systems to implement and monitor and processes to look at why things go wrong. But we must move to a more proactive approach in managing patient safety across our system. The other element that's critical to our better value care agenda is integrating our systems. And we've been on an extensive journey in the system with our integrated care program. But we must look beyond integrated care program and look at integrating our systems. We can only be assured that the value of the care we provide to patients traverses the boundaries of the hospitals where we deliver care. That means working with the primary health networks. It means working with our government partners and other non-government organisations to provide the best care to the community. These initiatives cannot occur without enabling factors, and digital health and analytics is absolutely critical. Governance and accountability of the system which we operate assists us in delivering this, and it all must be developed in a purchasing and performance framework. So the task ahead of us is complicated. However, there are a number of issues that have really come to light to me through this journey that we've been on that we need to address with greater vigour in the New South Wales health system. And they are listed here on the slide: the patient outcomes and experience, and the culture and engagement of our system. Compassion and innovation need to be the cornerstones of what we as an organisation aspire to. The evidence is overwhelming from the international literature that organisations or high-performing health systems that have a culture of compassion and innovation deliver the best and safest care to their patients. Further, the story or the experience of the patient must be recognised in our processes. And whilst we valiantly developed consumer engagement surveys and forms, I think we need far more meaningful documentation and measurement of the patient experience and the outcomes of the care that we deliver. So what we're working on extensively is how to streamline a process across the state to understand the patient experience and understand their clinical outcomes. So hopefully you'll recognise many of these themes that will be expanded on through the program today. We will cover culture, we will cover integrated systems, data and analytics. There are many, many things exciting and futuristic and innovative in what we'll explore today. I encourage you all to explore and learn from the talents of our health system, because they are indeed extensive, and for you to be part of our future in the New South Wales health system. And in addition, I'd like to say, I hope you have a really, really good day. Thank you.